Did anyone see the investigative story in the Bloomberg News last week about Mount Sinai Medical Center in New York City? Some of you may know this, but Mount Sinai has a world-renowned cardiac center. It was built up over the last decade, and it is especially well known for the high quality of its care and for doing a lot of cardiac catheterizations and cardiac stents. These are done in a special room called a cath lab or catheterization lab, and Mount Sinai has plenty of them. But what's not so well known is the fact that Mount Sinai used revenue from its cath labs to dig itself out of a deep financial hole. Today, Mount Sinai does more catheterization procedures, including stents, than any other hospital in New York City. And that's saying something because there are 32 hospitals that are licensed, that have licensed cath labs. And as anybody in a hospital C-suite can tell you, a cath lab license is basically a license to print money. In 2012, Mount Sinai doctors performed 4,729 stent-related procedures. On average, a stent brings in about $20,000 in revenue, and that means Mount Sinai made $94 million in 1 year on one class of procedure. $94 million. They made so much on caths that they could pay Dr. Salman Sharma, the head of the department, $4.8 million a year. Now, if there are any hospital CEOs in the audience tonight, they're probably thinking to themselves, gee, I got to hire a guy like this Sharma to build up my cardiology program. And they may think that because everybody in healthcare knows how much you make on caths. Cath labs are to hospitals what, well, I was going to say what ATM machines are to thieves, but I think that might be going too far. And I'm sure that many of the patients who were cathed at Mount Sinai were actually helped by the procedure, but it's a pretty good bet that many were not. On average, only about half of the cardiac procedures done in the US are for patients who are more likely to be helped by it than harmed. Think about that for a second. More likely to be helped than harmed, and that was true, clearly true for about half. For 12% of patients who get a cath, the chances that they will be harmed were higher than the chances that they would be helped. And for another 38% of patients, the chances of a good outcome are uncertain. And excess stenting and other cardiac procedures is just one area where we overuse healthcare. The sad fact is if it brings in revenue, it will almost certainly be overused. Many of you have heard these statistics. But for those who have not, at least 10% of the care we deliver in this country is unnecessary. Perhaps as much as 30% is what some people estimate, and I have heard some physicians estimate that it's about half. That's a lot. But think about what 30% means. That means we're wasting $800 billion.